All right, back pain, neck pain, leg pain. It can really get you down and force you to stop doing the things you love to do.
Yeah, we met a man from Burlington who's suffering from those same ailments. But a year and a half ago, he had surgery, which gave him a new lease on life.
Melissa Cole visited Starling's Comprehensive Spine and Interventional Pain Management Center in New Britain to meet him.
A year and a half ago, severe pain was interfering with 69-year-old Stan Valinsky's busy life.
And it had gotten to the point where the pain was so bad that it goes into your legs, like pinched nerves, and it was painful just to walk to the kitchen to get a glass of water, to walk, every step I took was pain.
Stan had a short relief from a previous surgery.
Hey Stan, what's going on? How are you?
Good to see you.
But when the pain came back in full force, his primary care doctor recommended Dr. Farhan Karim, an orthopedic spine surgeon at Starling's Comprehensive Spine and Interventional Pain Management Center.
All right, so these are Stan's x-rays?
Yeah, these are Stan's x-rays. These are his before and afters, actually. So he's a complex patient. He has something called we call lumbar spondylolisthesis, which is Latin for slipping of the spine. It's basically when the spine slips forward, right? So the goal of the operation was to obviously get that spine back aligned, right? And then more significantly, we use this device over here along with the screws and rods in order to give him stability and bring his spine back to normal.
Dr. Karim says Stan's condition is pretty common, and though he tried conservative treatments, nothing seemed to bring relief.
His legs were hurting, he had decreased ability to walk, and he was having increasing numbness down his legs. So that's a very concerning thing to us. And he had failed extensive rounds of conservative management. He's had the injections, he's had therapy, he's tried water therapy. So I think this was, he was ready for surgery.
A lot of times you hear back surgery or spine surgery, you're like, oh my gosh, that's so many nerves, and you get nervous.
Absolutely, and that's kind of our goal here with our Comprehensive Spine Center, to make patients understand that surgery is still the last resort before before you've exhausted conservative care. However, there are certain indications like weakness of extremities that require surgery, and we want to do the best and appropriate techniques for patients that will target their pathologies.
There's a whole team here that will create the best treatment plan for you. Oftentimes, pain can be managed without surgical intervention. Dr. Kayvon Alizadeh specializes in pain management.
Simple treatments would be functional therapies, such as physical therapy, occupational therapy, acupuncture therapy, and then there are other treatment plans, such as injection therapy, which is a lot of what I do.
Injections can reduce inflammation, which in turn reduces pain. And sometimes non-habit-forming medications are prescribed.
We have a variety of medications that we use that are generally non-opioid based that can help reduce patients' pain symptoms and improve their quality of life.
The whole goal here is to get people back to doing what they love, pain-free.
You're back in the pool, you're back doing your exercises, you're going on your vacation, so totally happy with that.
Yeah.
So how soon after the surgery did you start to notice all these positive changes?
Immediately. The first day, and when the medication wore off, I put my foot down expecting the worst, and nothing. And I'm so happy. You get goosebumps. I felt great. Oh God, I can walk again. I have family down in New Jersey. I couldn't see them because I couldn't make the trip for 2.5 hours. So I was back home for Christmas, it was really great.
That's awesome, right?
Yeah,
it's terrific.
So nice when you can feel good again. Starling's Comprehensive Spine and Interventional Pain Management is accepting patients. You can find their office on Lake Street in New Britain. Give them a call also at 860-832-4666.